All right, welcome back. Dr. Andrew Gurecki, hip pain specialist. In this video, we're talking about how, regardless of your diagnosis of hip pain, there's really only two injuries. There's only two ways to injure, two types of injuries of the hip. Now, I know that sounds maybe like an oversimplification, but let me explain. Some of the most common diagnoses that I hear about are arthritis, degenerative joint disease, bone spurs, osteophytes, labral tears, hip bursitis, hip impingement. And it's interesting when you think about it, there's really two things that happen here. And I'm going to use this kind of confusing graph to help explain. So if we look at the x-axis from left to right, if you follow my mouse from left to right, this represents time and money. And if we follow the y-axis as we go up the chart, this represents severity of symptoms, dysfunction, disability, impairments, pain. And so the first type of hip injury is called an acute trauma. And this is represented in the gray line. So typically, day one, the severity of symptoms were very severe. We know exactly what happened. So you think like, I fell off a ladder, I got hit by a car, I was in a sports injury. Those would be examples of acute traumas. Usually they're very expensive, right? And sometimes they require going to the urgent care or emergency room. And then as time goes on, as we move to the right here, you'll notice the severity of dysfunctions become less and less every day until eventually everything's healed up and you're feeling good, right? The reason that that's able to happen is because the body is designed to heal itself naturally, right? So the way that it does that is it's because the thing that was causing the trauma only happened one time. It was a moment. The traumatic stressor isn't happening all the time. So the body is able to go to sleep at night, recover during our REM sleep cycles, release human growth hormone, and our body then repairs and recovers and our injuries heal. And that's one type of hip injury. Most of the people I meet with hip pain don't have this type of injury. Some do, but most don't. The other type of hip injury is in the shaded line or the colored line here from green to red, and that's called a cumulative trauma disorder. And what that story typically looks like or sounds like is on day one, the symptoms, I don't know, they were kind of there, but they went away a couple days later when I was shoveling snow. And then as time went on, they become a little more severe and more noticeable. And now here we are 3 years later, and they're kind of really severe. They're happening all the time, and I'm on the borderline of being disabled, right? This is typically where I see people, by the way. This is where people come and see me in the red zone. And what's happening is it's getting worse as time goes on. And the reason it's getting worse and the body is not healing itself is because the trauma, the stress, the damage is accumulating. And it's accumulating because it's a movement disorder. It's your body's losing the ability to move in certain places. And so the trauma is actually getting worse because you're not fixing the problem. You're either ignoring it or you're altering the symptoms with medications or injections, right? And so that's really the reason why we don't want to ignore it. We don't want to mask it because it's going to get worse. It's a cumulative trauma disorder. And so in order for us to fix these cumulative trauma disorders, we got to get rid of the trauma. We got to fix the thing that's causing the stress so that we can bend the curve here and get down in the shaded line and let the body heal itself naturally. Because we know the body can heal itself naturally. It's proven. Acute traumas are a great example of that. It's the chronic cumulative trauma disorders or overuse injuries that are challenging, and it's because we're not, as a healthcare system, identifying what's causing the trauma. So we're going to talk more about that. I hope you enjoyed.